Again, I'm Joel Newman with UNOS, United Network for Organ Sharing, and you've heard a couple, as a quick background, because there's a small distinction that I should explain. UNOS, that was interesting. UNOS, United Network for Organ Sharing, we are a national non-profit member organization. The membership is all of the transplant hospitals in the United States, all of the organ procurement organizations that recover organs for transplantation. We do activities to support transplantation in all realms. A lot of really the majority of UNOS's efforts are in support of what is called, and what's been referred to already as the Organ Procurement and Transplantation Network, or the OPTN. And that is a federally contracted network. We contract with the Health Resources and Services Administration under HHS to essentially monitor and manage the allocation, the distribution of deceased donor organs with patients nationwide. So UNOS is a private entity. We operate the OPTN under federal contract. UNOS, as a private organization, is absolutely in support of this measure for the reasons stated. We've signed a letter of support along with some of the key clinical transplant societies. Really, the case that's been made is certainly what our organization believes and supports. From the OPTN standpoint, from the federal contract, the management of the allocation network, patient safety is really a key and a byword in all that we do. The OPTN network is not involved in the medical decision making, the clinical decisions that the practitioners make. But we maintain a system that for every individual who is awaiting a deceased organ transplant in the United States, we have a computer-based system, 24 hours, very highly secure, very closely monitored with federal oversight as well, to make sure that the information is correctly conveyed to the transplant practitioner so that they can make those decisions and they can determine whether to accept this particular organ for this particular candidate. Dr. Stock had mentioned, and I think that's a great parallel in the sense that there are individuals, there are donors in the United States who have hepatitis C. There are individuals who are transplant candidates who also have hepatitis C. We have a system that the acceptance criteria can be put into the system from the transplant center. We would accept an organ from this individual if that donor is hepatitis C positive. And again, that is a clinical decision that can be made. That is something we certainly support. From the standpoint of, assuming that there is a change to the federal law, there is also some federal regulation which sort of points back to that. We do have a policy-making process that if those decisions are made, we would have to amend our policy. But we do have, it's a very open, a very transparent policy. We have practitioners, we have people that have benefited from donation and transplantation, or our members of our committees and our board of directors. We would certainly take that federal guidance back through our policy-making process, and we could implement that in a very responsible and operational fashion.